Good evening and welcome to our COVID-19 update. I am Ladi Akeredolu. Here are the highlights at this hour. Midterm report on presidential task force activities coming, just as federal health authorities announce plan to improve testing and case management capacities for COVID-19. NCDC unveils new online infection prevention and control protocol, says over 15,000 medical personnel have been trained in IPC. And more school grades resume in South Africa as U.S. death toll from COVID-19 hits 130,000. When the Presidential Task Force on COVID-19 was inaugurated, President Muhammadu Buhari gave it a 6-month mandate. As it approaches the halfway point of this mandate, the PTF is preparing a midterm report on its activities, and that's according to its chairman, Mr. Boss Mustafa. Speaking today at the briefing of the task force in Abuja, Mr. Mustafa insisted that Nigeria could overcome the COVID-19 virus.
Of a comprehensive examination of the steps taken, the challenges, and charting the way forward. Capacity and opportunities for testing have been expanded, with the opening of 40 laboratories now and creating of more testing centers, including some certified private sector medical facilities. I therefore encourage all Nigerians to get tested to enable us fight this pandemic. We have done it before, and we shall do it again. The handling of the Ebola virus, Lassa fever, our becoming a polio-free country, and successful exit from other communicable diseases over the years should give us comfort that COVID-19 would also be put behind us.
The federal government, in the meantime, has sent a 17-man delegation to Cross River State to help it with its strategy against coronavirus. The Minister of Health, Dr. Osage Hanere, said this today at the Presidential Task Force daily briefing on the COVID-19 pandemic. Two states, Kogi and Cross Rivers, have maintained the position of being COVID-19 free, with the governor of Kogi State, Yahya Bello, insisting that the whole issue is a scam. Our correspondent, Gimba Umar, reports.
A country torn by a silent killer. The fears are evident. Masks are now worn by almost everyone as the Nigeria Center for Disease Control reports COVID-19 cases in 35 of the 36 states. 2 of the states vehemently reject any report of a possible COVID-19 case. They simply will not have it.
I don't want to believe the language of mutation. Coronavirus behaving like chameleon, change to white today, tomorrow change to black.
He is the most defiant in the rejection. The NCDC has officially reported 4 persons living with the virus in the porous confluent state, sharing borders with 9 other states. They have all reported the virus. In line with the steps to stop its spread, guests from the Akeredolu Bello Memorial Foundation on a visit to the governor came along with face masks for him and his people.
Think for him, please.
We are confident that the measures already taken by the state government will continue to keep Kogi safe from the pandemic.
Senator Shekaro and his entourage also advocate against rape, another scourge in the country. Crossing over to Cross River State, the situation appears to be equally dire. The state NMA says that the virus has affected its members and has embarked on a strike.
The 2 doctors who I have direct contact with, I said yesterday night I called them, have you been contacted by anybody for contact tracing or anything? And they said no, they are all in their houses on self-isolation.
The Commissioner for Health in the state disagrees, saying the virus is non-existent in the state.
the claim is that samples was sent to Ebonyi State, and that they got results back from Ebonyi State. As a state, we do not have powers over Ebonyi State to announce anything from Ebonyi State or stuff like that.
In the meantime, the Federal Ministry of Health has sent a 17-man powerful delegation to Cross Rivers to help solve the challenge.
Family health are represented in the delegation to ensure the appropriate technical handshake between federal and state Cross River State service delivery pillars.
Perhaps this is the needed intervention for the NMA and the state government before COVID-19 gets out of control. Gimba Umaru, Channels Television News.
In Ondo State, Governor Rotimi Akeredolu says he's now tested negative to the COVID-19 virus. The governor made this known earlier today in Akure, the state capital, where he thanked the people of the state for their prayers. It will be recalled that Mr. Akeredolu had announced his positive status on Wednesday last week via social media and said he would be going into isolation with a view to being treated.
As you all know, I have also been a victim of COVID-19. Though asymptomatic, I tested positive to the virus and I immediately went into isolation with supervised home management. Those days in isolation were a defining period for me. They convinced me further of the right track we have chosen to mobilize our people against the deadly pandemic. After some days in isolation, our team of doctors decided to take my sample and I was tested again in accordance with the treatment protocols of COVID-19. The result came earlier today. I tested negative.
As domestic aviation prepares to restart on Wednesday, the minister, Senator Hadi Sirika, says anyone not traveling, regardless of status, will not be allowed into the terminal building at any of the nation's airports. Senator Sirika, while asking for the cooperation of all, refused to be categorical about whether the issue of vacant middle seats in aircraft had been resolved, although he took time to explain that aircraft were already adequately equipped for these times.
To check in online, print your own boarding pass, and come to the airport. At the point when they need to see a boarding pass, it will be you, the passenger, that will cut the boarding pass and hand over, so there is no contact between you and the person. There's also a screen between you and the people checking those boarding passes. So you will board accordingly, maintaining physical distancing. So we'll use Nigeria Airspace Management Agency, their own procedures and process, to ensure that sequencing of flights are done. They will come in predetermined and go out predetermined, so that we know the amount of passengers we are emptying into our buildings, so that we ensure that the physically distant positions that we marked are respected. We don't have a case where we have overflooded the terminal buildings and passengers are having to stand and break those protocols. We will not allow it. We will ensure that it is done. Furthermore, President Muhammadu Buhari has approved, and this is a very serious matter for us, the hitherto big men, especially military men, members of the National Assembly, and the judiciary are culprits. They have all these their PAs and SAs, relatives of people that are not traveling, and they insist they must take them inside and onto the aircraft by protocol. This will not be allowed, will not be permitted, they will be stopped. For those of them that I know maybe they are challenged physically, they can go to a certain limit, but they will have to cede it. We will allow porters to assist them, and those who are diplomatically allowed, diplomatic services will be also rendered. So you have no need for your aid, because your aid, even if he attempts, he will not come in. And by the way, of course, firearms are not allowed in our vicinities. In the first, they come, and the culprits, I insist, are ministers, military men, National Assembly, and judiciary. Because we had only one encounter or so in recent history with the police, and almost none with the DSS, talk less of NIA. So these are the culprits, big men, and governors, yes, governors. Yeah, governors. So governors, please, we will not allow your aides to be in our airport.
Health authorities have been explaining the implications of the current numbers around the COVID-19 pandemic in Nigeria. Health Minister Dr. Sage Hanire told journalists present at the PTF briefing today in Abuja that the authorities have a plan that includes more testing, even though not random, but which will lead to a higher number of cases.
Taking the statistics of the month of June alone, where a total of 15,532 cases were confirmed from 74,580 tests, with 303 deaths on record. It means that just under half of the total fatalities so far recorded occurred in that single month of June. The reduction in case fatality rate is down to about 2.2%, as opposed to about 5% we have seen on global average. And it is in line with our plan going forward. But it also draws our attention to the speed with which COVID-19 is growing, the time it took to double itself, and the reminder that we need to improve on our responses in order to continue to strive for the best and prepare for worse. It is also the plan of the Federal Ministry of Health to boost overall COVID-19 sample collection by preparing all eligible public and private hospitals nationwide to become collection centers. This will require enormous work with state governments and NPHCDA to identify the facilities that can be used and the space within them, and also to conduct training for the personnel selected and supply a supply chain for both PPEs and sample collection kits, as well as the all-important logistics to go around to recover test samples and so to better utilize the available laboratory assets in the country, which even now are capable of handling far more cases than they presently do. However, the more we test, the more confirmed cases we shall find, of which the vulnerable will have to be prioritized for admission to treatment centers, even if they are not yet showing symptoms. Quite clearly, the earlier we can put those who are vulnerable under observation, under medical observation, the better the outcomes will be. States will therefore be encouraged to use all opportunities to isolate other asymptomatic cases who may not qualify for supervised self-isolation for the period they are deemed to be infectious or are at risk of infecting the vulnerable.
In what may be regarded as cheering news, the federal government has announced that this year's West African Examinations Council WAEC exam will hold from Monday, August the 3rd to September the 5th, 2020. The Minister of State for Education, Mr. Emeka Wajuba, in making the announcement at today's PTF briefing in Abuja, says all concerned stakeholders should use the time adequately to prepare.
The chairman of the PTF announced that school facilities will be available for those who want to go into revision classes. As soon as we conclude WAEC, we will take up the NAPTEB and NACO exams. The idea here is that we have a whole month from now till then. Those who can and those who are willing, the states who are willing, should make their schools available for their children to revise. We've done the most we can with our representative at WAEC, and we have this afternoon confirmed that the dates allotted for the exams will be from the 4th of August through to the 5th of September. Local timings will be published. From tomorrow, this is part of what we are taking into our concluding stakeholder meeting tomorrow with NCDC, Nigerian Union of Teachers. Everybody will be on concluding stakeholder meeting tomorrow. And these dates are what we're going to take into those. We'll be asking that those who are not prepared yet should please go and prepare. We are continuing with registrations for NACO. For those who have not concluded registrations along those lines, kindly get your, this is the time also to update and get your registrations done.
Meanwhile, students in graduating classes in public and private schools across Oyo State resumed classes to begin a new term today amidst the ongoing pandemic, but in compliance with government's directives. Primary 6, GSS3 and SS3 students were seen trooping into their schools for the beginning of the term in preparation for their exams, and also for schools who had written exams midway into the lockdown.
Students in graduating classes across public and private schools in Oyo State resuming at school several months after they went on compulsory break owing to the outbreak of COVID-19. In some of the public primary and secondary schools visited, they confirmed with the social distancing protocol right from the assembly ground, even as the cleaning of the school environment commences. Students in primary 6, GSS3 and SS3 were seen moving their desks and chairs to other classes as a way of spacing out in line with social distancing stipulations of the NCDC.
Because we have a big class for now, because we have been asked to, put them in staggered form, zigzag form. That was what we have done this morning. And about 15 of them, because we have 47 in SS3, so we are divided into 3, so that there will be, well-ventilated classrooms.
However, some of the students are already flouting the continuous use of face masks while in class.
You follow the same definition.
Head teachers and proprietors appear committed to ensuring all precautions are taken to avoid the spread of COVID-19 infection in the state.
Automatic pedaling for the washing of hands and sanitizing the hands, and we have the infrared temperature measurements to measure the temperature of the children. We also have the space distancing, the social distancing in our classes and among our teachers.
State exams have been scheduled to begin with immediate effect for pupils in public schools across the state, while a monitoring committee has been put in place to ensure the compliance to NCDC guidelines are sustained.
When we come back after the break, the NCDC releases guidelines, online guidelines that is, on safety and prevention control protocols. Please stay with us. A new online infection prevention and control protocol has been unveiled by the Nigeria Center for Disease Control. Its Director General, Dr. Chikwe Ihekwazu, says it is the result of several years of consultation as well as examination of best practices that can be adapted to Nigeria's environment. Dr. Ihekwazu also released guidelines for the conduct of elections in the era of COVID-19.
New online course that we've been working on for months. This new infection prevention and control course, while targeting healthcare professionals, will be enjoyable to anyone that has an interest. It is done for Nigerians, by Nigerian actors, acting out the scenes in Nigerian hospitals and healthcare settings. There's never been anything like this. It brings infection prevention and control to your doorsteps and the consciousness of everyone. We have worked very hard on this, making sure that the examples are examples that each of us will be familiar with. So that if you have a challenge in your office and you want to understand how to decontaminate your office after an event, you can go onto this course and learn how to do it. So it's open to healthcare workers, open to any Nigerian, because IPC is one of those areas that we don't really see as an outbreak response. We really want to transform how Nigerians, doctors, nurses, but also patients relate to infection prevention and control. We want next time patients go to a doctor, they know exactly when to insist that that doctor wears gloves, for what procedures he should be wearing a mask, and for now, obviously, he should be wearing a mask all the time. Some states will be holding state and local government elections this year. For the first time, we're holding elections of this significance during a pandemic. Therefore, we've developed these guidelines to support everyone involved, political parties, INEC, but most critically, Nigerians that will be going to vote in these difficult times. Voting still remains a civic responsibility, and even though we're in the middle of a pandemic, we have to find a way of doing this safely.
Let's take a look at the latest figures. About 153,000 COVID-19 samples have so far been tested in Nigeria, out of which over 28,000 have returned as confirmed coronavirus cases in 35 states plus the Federal Capital Territory. 11,665 patients have recovered from the disease, while 645 people have been lost to the virus. Breaking it down to demographics, the male population accounts for 66% of the total number of confirmed cases at 18,916, while the females hold 34%, which is 9,795. Young people between the ages of 31 and 40 remain the most affected age group. Community transmission of the infection continues, with more of coronavirus cases in Nigeria, 74% attributed to unknown exposure. Those who contracted the virus as contacts of known cases are 24%, while 2% of the total confirmed cases are due to travel history. A quick look at the breakdown of the COVID-19 figures at the moment by regions shows that Lagos in the southwest remains the epicenter of the pandemic with 11,244 cases, while states with the highest cases in other zones are the FCT in the north central with 2,181 and Kano in the northwest with 1,268 cases. Edo State leads in the south-south with 1,383 cases, while Borno returns to the top in the northeast with 528 cases, and Ebonyi still leads in the southeast with 508 cases. Joining us on the program via Skype from the Yaba area of Lagos is a public health physician, Dr. Ogonaya Igwelo. Dr. Igwelo, thank you for your time and welcome to the program tonight.
Thank you for having me.
Are you surprised by the rate at which this infection is progressing? Never mind what we have been told about what the statistics are, but are you surprised as someone in the front line of this?
I'm actually not surprised, because remember that what we are seeing at the cases that we are testing. And so there's this thing in public health we call the iceberg phenomenon. So basically, you have the lower part of the iceberg beneath the water, while like above the water, the part of the iceberg above the water are usually the cases that we see in our hospitals, the one we test, the ones that come in for either treatment. Well, underneath you have a large portion of that iceberg still being there. So this large proportion of the iceberg usually represents cases that are still ongoing within the community that have not even yet been tested. So I'm definitely not surprised. And with more testing, with increased testing, we are definitely going to find more cases because we are now at the phase of community transmission. So I'm not surprised.
The health minister talked about earlier on in the day, because part of the plan going forward, according to him, is that there is a process being put in place to increase testing capacity and the amount of tests that can be done, sample collection, improving the process and all of that. However, while that is there on one hand, on the other hand, there's still the issue that even the labs, we have about 40 labs right now, they're underutilized because people are simply not turning up to submit samples. How do you weigh this paradox?
Definitely, that is serious. That is a serious issue. I know there are states that are actually running below capacity, and why? Because you're having people not coming out, and this is why, if the national coordinator kept on talking about the importance of risk communication and community engagement, because that is the only way to get people to come out and do these tests. Because a lot of people are usually at home self-medicating, doing taking either this one thing or the other, which they shouldn't be taking. So this is part of the importance of, we keep emphasizing, that community engagement, ensuring that people know the right thing to do. And of course, we have the issue of, misinformation, then the conspiracy theories, and that didn't help either as well. So you're now having people hiding, and of course, coupled with the issue of stigmatization of people who are of the survivors. So that already now, of course, prevents some of these people from coming in to seek care. And that is definitely an issue, because we need to find a way to, encourage and, engage more individuals or more members of the community to come out to test. It's very vital.
The other thing that is there, of course, is the issue of medical personnel themselves who are battling this testing positive. The last time that the figures were released, I believe that was on Thursday or Friday last week, 882 medical personnel across the country are recorded as having been infected, although there are cases in other places that weren't recorded. Again, does this give you cause for concern?
It definitely does, because remember that our health workers already are we have our health workers compared to other countries. We don't have sufficient health workers in the first place. Now you have some of them, and the thing about the health workers is they're already at risk in two places, both in the community and in the hospital settings. So that is why it's definitely like a cause of concern, because we want to ensure that yes, the PPEs are coming in, they have access to testing, and they're also being managed and properly looked after. That way, you want to make sure that you're not having deaths, you're not having, of course, health workers as well, exposing vulnerable patients to the COVID-19 illness as well. So that's definitely a cause of concern, because these are our fighters, these are our soldiers.
Domestic aviation will start on Wednesday. Earlier on today, the Minister of Aviation unveiled, even more specific guidelines about how this would work. But he doesn't seem to have allayed all the fears of those who say that with this opening, you give room for even further community transmission. What do you make of this?
So the thing is, yes, definitely. Like I listened to what he said. They talked about how they will ensure they have the wash facilities. They will ensure social distancing. Then he explained the whole, the whole thing on the like in terms of the airplane and everything that will be done, the contamination. But it's still important that social distancing, if possible, should still be maintained even in the airplanes. Because remember that, yes, these measures are important and, they are very vital, but we want to make sure that social distance is there, because you can have the masks, but even with those masks, when there is no social distance, you can still have some passengers contracting the virus. So definitely it's a good development. I don't want to, because it's definitely a very good development what the aviation industry is doing, and I definitely commend them for it. But if there are things things like if it's possible that physical distancing, can still be done within these aircraft, because remember we might be having some vulnerable passengers still within these aircraft, to make sure that we're giving them optimum care and optimum safety as well.
Thank you very much, Dr. Ogodnaya Igwilo, for your time this evening. Dr. Igwilo joins us from the Yaba area of Lagos. It's been a pleasure having you with us on the program. Switching to our Abuja studios, where we're being joined by a medical laboratory scientist with bias in molecular basis of diseases at the University of Abuja Teaching Hospital, Mr. Alaba Ovie. Good evening, Mr. Ovie. Thank you for your time this evening and welcome to the program. I'll start off from where I stopped with the last speaker, and that has to do with the issue of aviation. The aviation minister spent a long time today explaining something about how aircraft air supply is processed, and therefore why it is safe for people to fly, even if the social distancing or physical distancing is not completely at the center of it all. Do you buy that argument?
Good evening, Mr. Ladi. Thank you for having me. I agree to some extent when you weigh the benefit of allowing people to travel, to fly, over keeping them. But by and large, I doubt the safety, the extent to which people in such aircraft will be safe. I doubt that, knowing that aircraft itself is an enclosed system, except, well, after 1 or 2 weeks of traveling, scientists can be allowed to come in and carry out some testing to ascertain how safe that is really. If not, personally, I just look at the advantage of allowing people to travel, to do their businesses, and over the disadvantage.
This, I mean, you have a bias for the molecular basis of diseases. Now, this COVID-19, what would you say about its molecular basis? I mean, is it easily the most infectious disease we've ever seen? Or are we exaggerating a little bit when we talk about the fact that it's spreading like wildfire? At least some people say that.
It's not exaggerated, and neither is it the most infectious diseases. In fact, even with us in Nigeria, we have more infectious viruses, like hemorrhagic viruses. Okay, but for this particularly of concern recently was one of the publication from EDE, where a particular gene, they call it D614G, that particular gene was isolated from about 5 people. Now that gene is known, it was said to be mutated, and that mutated gene was said to be the reason behind the rapid spreading, the ability of the virus to invade immune system attempt to trap it. So that gene should be looked closely at. If it's true the way it is in EDE, as profile in EDE, I think it should call for sober reflection that we are in for.
It isn't really a surprise, is it, that the schools some of the schools kept them away?
Well, that's true. Given the age range, the government actually gave the window for those who are not prepared enough to keep them at home. But funny enough, there is a court judgment recently, I think today, which says that the private nursery schools should be able to open if they can guarantee safety measures for the children. So even younger people than grade R may be going to schools for the private nursery schools this time around. So the grade Rs are going, but many parents are not. They're not confident enough to send their children to school. And some schools have actually said no. Eastern Cape, even the 3 levels that were allowed back in school today, they had to hold that back because of the spike in numbers as well. So they're looking at ensuring safety first before those ones will get back to school.
Yet from the report, from your report there, the Basic Education Minister is saying that all the grades must be back in school by the end of August. That is the timetable that she has, and that things have to go on.
Yes, that is the plan. But parents are still giving, parents like you who are petrified of children going back to school, they're given the option of homeschooling for their children. So it's not compulsory for if you're worried, you can keep your children back probably to repeat the year or do homeschooling. There's that option. But the plan is for them to go ahead because her argument is that of the 26,000 schools that had opened, only 968 had COVID cases recorded, which is about 4% of all the schools. That if it's not such an emergency to say, okay, hey, let's stop it here. But my worry is the issue of Gauteng with the high numbers now, which is looking at stepping back with the lockdown. That issue was brought up with her. What if Gauteng now steps back to probably level 5 or just elements of level 5? How will that be handled? She said they're in talks to see, nothing has been tabled yet. The National COVID Command Council will still have to handle that. Then they'll know how to deal with it. But the plan is for everyone to salvage the academic year. But there are people like Musi Maimane, the former leader of the DA, and other groupings saying, look, why don't you find a way to rearrange the academic year and just have the children stay back a bit and be safer before, probably past the peak of the infection rate before you send children back to school. But the department is confident enough. The minister says she's a bit worried even for her own grandchildren, but they have to keep going to ensure that the other side of it, that there's social ills that could come up with just not keeping children occupied. So they will handle the issues as they come to see if they can go on with the academic year and save the year.
Thank you very much, Betty. To continue to stay safe out there, no matter what happens.
Thank you so much.
And that's our COVID-19 update tonight. I am Ladi Akeredolu. Good night.